Hi, I'm Dr. Chuck. Welcome to Your Filthy Mouth. Today we're going to be talking about pregnancy and your oral health. Is there a connection? Absolutely. Stay tuned. See what you can learn.
Your smile is beautiful and possibly deadly. Dr. Chuck is here to tell you how your mouth can hold the key to your overall health. Now, about that filthy mouth of yours.
Hi, I'm Suzanne Lynn with Dr. Chuck, and this is Your Filthy Mouth. And today it's one of my favorite topics. One of my favorite episodes is pregnancy and how it's tied into what's happening with your mouth, because now it's two people that we're worried about with bacteria.
So, does the health of your mouth have anything to do with the developing baby that you have inside? Absolutely, it does. When you have any infections going on with gingivitis, periodontitis, any dental abscesses going on, that's all infection. That's all bacteria. That gets into your bloodstream. It goes all the way through everything. They're finding stillborns that are full of oral bacteria.
Wow.
So
from the mom?
From the mom.
Oh,
absolutely.
My gosh.
So you talk about a placental barrier. If they find oral bacteria in stillborns, obviously the bacteria got through it. They're finding oral bacteria in the brains of Alzheimer's patients. So when you talk about a blood-brain barrier, well, if the bacteria got through it, it's not much of a barrier. Right. So we have to understand that whatever's happening in the mouth, whatever infections you have, once it gets into the bloodstream, somehow it's going to find its way into that baby. So the healthier we can keep the mouth, the better it is for the baby.
So here we're told, be careful of your alcohol consumption, especially in the first trimester.
Yep.
But we're never told, hey, make sure you're keeping your mouth extra clean because you don't want that bacteria to go through the bloodstream just like alcohol does, just like too much caffeine, drinking coffee. This is so important.
And one of the things that happens is women, and I feel for women, you go through all these hormone changes with pregnancy. So you have something called pregnancy gingivitis, which means the gums become more inflamed, they bleed a little bit easier, and if you don't really stay on top of that situation, it can be uncomfortable to clean your teeth. And if it's uncomfortable, people tend not to do it as thoroughly as you need to do it. So now the problem just gets worse. So
it's that cycle.
That's it.
It hurts to brush, so you don't brush, and then it hurts to brush because you didn't brush.
Well, there used to be the old wives' tale that you'd suck the calcium out of the teeth. One would say, well, my teeth were fine until I got pregnant, and the baby sucked the calcium out. They found that's not really true. What happens is you go through the pregnancy gingivitis, you don't clean your teeth as well because it's tender, and you tend to have the bacteria build up, and you get more decay. You get the acids on your teeth from the bacteria that demineralize the tooth, and so yes, now you're getting more cavities, but it's not because of the calcium being sucked out, it's because of the bacteria not being cleaned off.
And can this affect, as far as how you deliver or anything like that? Having extra bacteria, could that...
Well, one of the studies shows that if you could just have oral health on pregnant women, you could save over 40,500 preterm births in the United States every year.
Well, I don't understand the connection between bacteria in your mouth and early delivery.
Well, certain bacteria they've shown that can trigger the contraction of smooth muscles, and there are other factors involved, but when you don't have a completely healthy situation, sometimes your body wants to do things that we don't want it to do.
Right, because it's reacting to it. Yeah. Okay, responding.
So sometimes you have, a preterm birth, and those are tough. They're tough on the baby, they're tough on the family,
sure.
They're tough on the insurance, all those, because it's preemies are not cheap. They're pretty expensive.
Yeah. And I'm just thinking how the lungs are the last thing in the baby to form, and the more that they can cook and be inside in the natural way, that's the best environment.
Well, when you're supposed to be in the oven for 9 months, that's kind of what you want to do. And if you take something out of the oven before it's done, it's not done yet. So that's why they have the incubators to keep the baby alive, so it can continue to develop those organs that need to be completely developed.
So I think one of the biggest concerns as a pregnant mom was going to the dentist and talking about x-rays.
X-rays have come a long way. When I was in dental school, this is back a long, long time ago, but they had regular speed film. And then they came out with a film called ultra speed, and that used 1/10 of the radiation from the regular speed, which was great.
Yeah.
But now we have digital radiographs, digital x-rays, and that uses 1/10 of the ultra speed film. So you're getting very, very little radiation. Plus, you have the lead shields if you need it. They still don't recommend X-rays for the first trimester.
Okay. Just as a safety.
As a
it's not-
safety
okay,
thing,
Right.
but I would much rather take an X-ray of a tooth and find out that you had an abscess on that, so you could treat the abscess.
Sure.
Because the consequences of that abscess and the infection running through your whole body are way worse than the consequences of protected with lead shield and all that radiation from a digital dental X-ray. So let's make sure we're comparing, which is the lesser of the two evils.
Is there any type of procedure that you should not have done when you're pregnant? Like, I worry about women who maybe don't realize that they're pregnant and they maybe get a crown with silver or something like that. I don't know.
Not that I'm aware of.
Okay.
I mean, the challenge you might have is anesthetic, and usually that is pretty much localized.
Okay.
That's why we use vasoconstrictors when you give an anesthetic, so it stays in that area for a while.
Oh.
But to me, the greater risk is leaving dental unhealthy situations there for an extended period of time, even if they don't hurt. Lack of pain does not mean it's healthy, and that's the biggest thing. The number one reason people don't see a dentist is lack of pain. It doesn't hurt. I'm fine. I don't need a dentist. Well, when you're pregnant, you want to make sure you have a healthy mouth. Right. So if there's any way of getting a good oral examination prior to getting pregnant, that would be the best thing. But if you are pregnant, you want to make sure that...
I'm in my head going, hold on, honey, I got to go to the dentist.
let me make that appointment first.
That's right.
No, I realize sometimes they're planned, sometimes they're not. That's life. So, but you want it to be healthy.
Yeah. And, just kind of tying in something in real life that happened that you said reminds you of, bacteria in your mouth is we're dealing with this mold in our kitchen. We had a leak, and it's probably been there for years. But we had no reason to pull all the stuff out from under the kitchen sink. And when we finally heard the dripping, which would have been the pain of the plumber coming over, realizing that we had mold, you said, that's what happens with your mouth, is that it's all builds up. There's no pain. There's no reason to look unless there's a problem. That's why maintenance is so important.
Well, the older I get, the more I like pain, because it's the best motivator that I've ever found. But lack of pain doesn't motivate anyone. So this is why it's important, even if you feel perfectly fine, to get an oral examination. Had a patient just the other week who we were doing our thorough examination on him, and he's like, "Oh, this is a bunch of stuff. I don't need it. I just want my teeth cleaned." I said, "Well, we do an examination first."
Yeah.
And so when I'm going through the radiographs, the X-rays with him, and I'm showing him on the root of this one tooth, you see that big dark area around the tip of that? I said, "That's an abscess. That's an infection." He said, "But it doesn't hurt." I said, "That's why we're doing the examination.
Wow.
It doesn't hurt.
Wow.
You didn't know it's there." And they've shown that 50% of heart attacks are triggered by symptom-free chronic oral infections that can go on for decades.
50%.
It's a big deal. It's a huge... I'm not the researcher, but this is
Right.
what the researchers say.
Wow.
And that's why I say go to the links that we have on our Your Filthy Mouth web page, because you can go right to the research that shows that. I'm just the messenger. I'm a regular... used to call them wet-fingered dentists, but we started wearing gloves after I was out of dental school. So, we didn't wear gloves back then.
Really?
Yep.
A lot's changed.
Yeah, a lot has changed.
Yeah.
Yeah. So...
Cool. All right, well, why don't we come back with the question of the week?
Here's Dr. Chuck's question of the week.
Hey, Dr. Chuck, this is Margie. Are sealants a good idea?
I love that question because when I was a kid, I got sealants and I've only had one cavity in my whole life. Sealants may have been put in even after that cavity. So, they do a good job. Is that
Absolutely.
Right? Yeah?
Sealants do a fantastic job. One of the things, in fact, I had a patient that I ran into. I was down in Orlando, and she came up to me and said, "Dr. Reinertsen?" I said, "Yes, ma'am." She looked at me and says, "You don't recognize me, do you?" I said, "No, ma'am." She said, "Well, I'm so-and-so," and she gave me her name. I was like, "Oh, now I remember who you were." Well, this was like 20 years that I haven't seen her. She's now moved to Orlando. She's grown up. She's married, has a couple of kids. Nice gal. She said, "I want to thank you for my sealants." And I looked at her and said, "Well, why is that?" She says, "I see the dentist on a regular basis down here, and I haven't had any cavities since, and every time I come in, they say those sealants are still holding up just great."
Wow.
So if you'll put them in right, and you have to take your time, you have to have you have to follow the protocol. You have to do it right. But if you'll do those things, they will protect. It's those deep grooves. That's where most of the cavities, especially on children, take place. And the sealant seals in that deep groove so that the bacteria can't get down into that groove and as I tell the kids, poop on their teeth.
Right.
Because that's really what's happening.
Bug poop.
Sugar bug poop.
That's
Yep.
right.
But if we can seal that out and make it a whole lot easier to keep clean, cavities are cut way down. So I'm a complete advocate for sealants. Anything we can do to prevent the problem. Like I say, prevention isn't sexy, but it saves time, money, and pain.
Great. And that was a great question. If you've got a question for Dr. Chuck, go ahead, write in. Go to yourfilthymouth.com. And we are in the process of ordering some pretty fun things that we'll send out to you if we use your questions. So, okay, well, let's go ahead and wrap up today with the 3 takeaways. Number 1 is, why is it important when you're pregnant to have good mouth care?
Because what happens to you doesn't stay with you, it goes to the baby. So the healthier your mouth is, the better it is for the baby. There are other things that can affect the baby, but the mouth is certainly one of the factors. So make sure you have a healthy, clean mouth.
Okay. Number 2, gingivitis it's a real struggle when you're pregnant.
You go through these hormone changes, and it makes it more challenging to keep them clean. So, but once you get them really clean and keep them clean, the gingivitis isn't near as bad. The pregnancy gingivitis isn't as bad. So it's really to your benefit to do the very best you can, keeping those teeth clean, not just with brushing, but cleaning in between the teeth, whether it's flossing, water irrigation, those little brushes that go in between there, whatever it takes. There's more than one right way, and there's a whole lot of wrong ways.
And number 3 is, if you're pregnant, outside of the first trimester, X-rays are safe.
Really, especially with the digital radiographs that we have today, digital X-rays, because you're getting just a fraction. I heard one person say that you actually get more radiation walking from your car to the front door of the doctor's office.
Wow.
From the sun
Wow.
than you do from getting some dental X-rays. And you'd much rather identify a dental problem early and take care of it than let it continue to grow.
It's thundering out. That's God saying, listen to this show. This is really important. So
This is Florida in the summertime.
That's right. Yeah.
Yeah.
Well, thank you for watching Your Filthy Mouth. And we want to just really encourage you to share this information with friends, with family, especially if someone that you know is pregnant. Just shoot them the link so that they can see this and really be educated and up to speed on what they need to know.
Yeah, and this is true no matter where you live. This is the same
Right.
thing whether you're man or woman, young, old, black, white, green, purple. It doesn't make any
If you're
difference.
a pregnant man, though,
well,
I don't know. Definitely contact us. We'll have you on the show. But you're right. I mean, this is information. Keeping your mouth clean. What's happening in your mouth is affecting your body. And Dr. Chuck, you're so smart. You are really helping a lot of people. And subscribe. Hit the subscribe button so that you don't miss any of the episodes.
It's basic information, but if you don't know it, it's not that basic.
Yeah.
So,
Yeah. All right. Well, thanks for being part of Your Filthy Mouth. We'll catch up next time.
thank you.
This has been Your Filthy Mouth, a weekly podcast about how what happens in your mouth affects the rest of your body. This is important information, so please share it with your friends. Don't forget to hit the subscribe button on YouTube, iTunes, and all the other podcast sites. And drop by yourfilthymouth.com to ask Dr. Chuck a question or find dozens of links to information about oral systemic health. We'll talk to you next week.